So you've said all of Gaza is being systematically starved by design and that children are paying the highest price. And you've described this as a man-made famine. What is your organization seeing and who bears responsibility for this crisis?
Thank you. Yes, look, what we're seeing, we have over 170 colleagues there, mostly Palestinians in Gaza on the ground. Save the Children is operating to basic healthcare clinics as well. And our staff are first and foremost saying that they are now also hungry themselves. And we see children and pregnant women presenting in our clinics with malnourishment symptoms. And those numbers have been rising incredibly fast over these past couple of weeks and months.
And we know Israel blocked aid for months, and some is getting through now. It's only a trickle. And Save the Children, like many organizations, has trucks full of life-saving supplies waiting at the border. Can you tell us specifically what's ready to go and why is it still being blocked?
We have 50 trucks or so waiting, literally physically waiting at the border, and we have many more supplies in the pipeline if we were allowed to get in. Yes, we have life-saving aid in those trucks, medicine, hygiene kits for women, clothes for children, etc., malnutrition treatment supplies. But we haven't been able to get anything in since March 2nd. And that is leading to a dire situation. We're running out of malnutrition treatment over the coming few weeks if that situation doesn't change. The supplies are available. It is incomprehensible to us that those supplies are not being let in. This famine is man-made, and long before it was declared a famine, which is this rather technical term that people will then start to focus on, children were already dying of starvation. They were already suffering from malnourishment symptoms, but also diarrhea and other diseases that, because you are that weak, your body is less able to withstand.
And what are Israeli officials telling you about why those trucks are not being allowed to cross through that corridor?
We often actually don't really get any feedback. We're asking the authorities we follow all the procedures that we need to follow in order to let trucks in. It is very precise. We give all the details. We give them a bill of lading, so what's in the trucks. And so far, none of that has been let in. Whatever we've been able to still get in Gaza has come through some of the UN agencies where there has been some aid now dripping in over these past couple of weeks.
And according to the Palestinian Bureau of Statistics, over 17,000 children in Gaza have lost both parents. It's the largest orphan crisis in modern history. I just want to show some footage of a graduation that happened earlier this week at the Al Wafa orphanage in Khan Yunis, where these children, stood there. Obviously, no parents there to cheer them on, to celebrate the fact that they've completed some education. What can be done beyond the lack of food and medicine? What can be done to address their emotional and mental health needs, both now and long term?
Yeah, this crisis is breaking all the wrong records, and again, entirely man-made and preventable as well. What can be done? Look, aside from our health clinics, we're also running what we call child-friendly spaces where children like the ones you've just shown are being cared for. We have trauma-informed care there. We let children be children. We are starting to help them overcome trauma. But of course, it's very difficult to run those clinics and those spaces safely if there is no ceasefire, if there is still a risk that children can die when you bring them together in a particular location, and we cannot be guaranteed that nothing will happen to them there.
Yontia Saripto from Save the Children, we appreciate all the work you and your team are doing on the ground. Hopefully your trucks can get into Gaza soon. Thanks so much for joining us and staying up at this hour.